In healthcare, every second matters. But in hospitals across the country, clinicians often spend valuable time on tasks that pull them away from what matters most: patient care. Chasing meal updates, calling departments for housekeeping requests, or waiting on hold to coordinate non-clinical services. These small interruptions may seem routine, but they add up quickly, creating workflow disruptions, caregiver frustration, and delays that impact the patient experience. So the question becomes, what if healthcare teams could eliminate these interruptions and focus fully on bedside care? That's exactly the challenge TouchPoint Support Services set out to solve. And the result is a powerful innovation designed specifically for the real-world needs of hospitals, the web-based status tracking solution. Today, we're going to explore how this technology is transforming healthcare operations, empowering caregivers, and helping hospitals deliver more efficient, compassionate care. Modern healthcare environments are incredibly complex. Clinicians must coordinate patient care, manage clinical documentation, and respond to constantly evolving needs, often all at once. But alongside these critical responsibilities, caregivers are frequently pulled into non-clinical tasks like checking meal delivery status, requesting room cleaning, coordinating patient transfers, or communicating with multiple support service departments. These tasks may seem small individually, but collectively they create constant interruptions and inefficiencies. In many hospitals, clinicians still rely on fragmented communication systems, phone calls, paging systems, or manual coordination to get answers. This leads to time lost, waiting for updates, delays in patient services, increased administrative workload, and frustration for already busy caregivers. Clinicians often find themselves limiting the time they can spend directly with patients. And when nurses are stretched thin, the impact extends far beyond workflow. It affects staff satisfaction, operational efficiency, and ultimately the quality of care. Clearly, healthcare organizations needed a better solution. TouchPoint partnered directly with hospital operators to design a new approach. Instead of building technology in isolation, TouchPoint collaborated with frontline caregivers to understand their biggest challenges: workflow interruptions, inefficient communication, and administrative overload. From these real-world insights, the web-based status tracking solution was created. This innovative platform is a healthcare workflow management tool designed to streamline coordination between clinical teams and support services. It brings together key operational functions like patient dining and housekeeping into one unified real-time dashboard. And the goal is simple: remove friction from hospital operations so caregivers can spend more time focused on patients. The platform was initially launched in 5 pilot hospitals to improve patient meal ordering and delivery processes. Based on caregiver feedback and usage patterns, new features were added and refined. The success of the pilot led to rapid expansion to 20 sites and eventually national deployment, proving the platform's adaptability and impact across healthcare systems. At the heart of the web-based status tracking solution is real-time operational visibility. Instead of making phone calls or searching through multiple systems, caregivers can access a single dashboard that provides instant information about patient services. With this platform, clinicians can view patient dietary needs, restrictions, and medication requirements before meals, monitor meal tray delivery status by room, facility, and time, encourage patients to order meals or assist those unable to do so independently, submit housekeeping requests instantly, assign tasks to nearby environmental services staff, and track requests from assignment to completion. This streamlined workflow eliminates the need for many routine phone calls and dramatically reduces communication delays. For example, before implementing the system, a nurse might spend several minutes or longer trying to reach a department by phone. Now, those same requests can be completed in just a few clicks. As one nurse manager in Austin, Texas explained, tasks that once required multiple phone calls can now be completed in minutes using the web-based status tracking solution. The platform also integrates seamlessly into hospital workflows through single sign-on access, allowing caregivers to log in using their existing credentials. And because the system is accessible from in-room computers, clinicians can check meal statuses or submit requests without leaving the bedside. The result is a smoother, more efficient hospital environment where support services and clinical teams work in sync. The impact of the web-based status tracking solution has been significant and measurable. Hospitals using the platform have reported 64 to 83% reduction in nursing calls, 47% reduction in department call wait times, more than 80 active daily clinician users. These results demonstrate how operational technology can transform everyday workflows in healthcare environments. But beyond the numbers, the biggest benefit is time returned to caregivers. By eliminating unnecessary calls, reducing interruptions, and providing real-time visibility, the system allows clinicians to work at the top of their license, focusing on clinical expertise rather than administrative coordination. And that shift makes a real difference for patients. When caregivers spend less time managing logistics and more time at the bedside, patient experiences improve. Care becomes more attentive, responsive, and compassionate. For hospital executives, nursing leaders, and healthcare administrators, solutions like this address some of the industry's most pressing challenges. Healthcare systems today face workforce shortages, increased patient volumes, rising operational complexity, and growing expectations for patient-centered care. Technology alone doesn't solve these issues, but technology designed with caregivers in mind can remove barriers that slow teams down. TouchPoint's web-based status tracking solution represents a shift towards smarter operational support, where technology empowers clinicians instead of adding to their workload. By connecting support services and clinical teams through one intuitive platform, hospitals can create a more efficient, responsive care environment. And that ultimately benefits everyone: patients, caregivers, and healthcare organizations. TouchPoint believes that operational excellence is a critical part of delivering exceptional healthcare. The web-based status tracking solution is more than a digital dashboard. It's a smarter way to support frontline caregivers. By reducing friction, improving communication, and streamlining support services coordination, hospitals can give their teams the one thing they need most: time to care for patients. Because in healthcare, every second matters. If you're a healthcare leader looking to improve workflow efficiency, enhance caregiver satisfaction, and optimize hospital support services, TouchPoint is ready to help. To learn more about how the web-based status tracking solution can transform your healthcare operations, visit TouchPointSupportServices.com and start your journey toward smarter, more efficient care. And if you found this video helpful, be sure to like, subscribe, and share it with colleagues who are passionate about improving healthcare delivery. Together, we can create better systems that support the people who care for us all.